Hello and welcome to this edition of Where is Washington Taking Our Country Back? I'm Steve Carlson, the producer of this show, and right now I'm running as the Independence Party candidate for the 4th Congressional District of Minnesota for the U.S. House of Representatives. I'm one of those Tea Party candidates. I'm a person who watched with disgust, actually, as I saw in Washington that they were putting together, they were getting straight to our health care, they were putting into place something that was basically just a monstrosity, a hodgepodge of half-baked ideas, which was basically driven by spending money for bureaucracies, greatly increase our quality of life through medicine and through health care. But what we see put in place out in Washington enrages many people because they don't want the federal government to mess with that. And we've actually seen that healthcare is being taken away from people, generally older people, who are, as Betty McCollum says in this debate, are largely women and also are overwhelmingly Caucasian. And we're seeing a distribution away from a focus on that, even though the country as a whole is still committed to making Medicare and Social Security solvent for the future. And yet the current action by the administration raises the issue. Do they really want to maintain that high quality of life and life expectancy?
If you guys are ready. It has been widely reported that the health issuers are building increases into the 2011 rates to cover the Obamacare insurance mandates. Examples: no patient costs for preventative care, coverage of adult children to the age of 26, no limits on lifetime coverage, etc. If elected or re-elected, what will you do in response to the events, and what do you believe should happen to Obamacare in the next Congress? Mr. Carlson.
Okay, that is a very major question. I can tell you I've read the House Resolution 5808. I haven't read it all through, but I'm not intending to vote for it. That is to establish the public option in Obamacare. It's already been introduced. It's got 120 representatives from the Democrat Party already sponsoring it. And I think that's a very bad idea. Now what I would do, first of all, I want to tell you, the goal here is to save lives, is not to cut off health care to anybody, but is to put in place a system that actually is constitutional and makes sense. And so what I would do is to immediately call for its total repeal. I would put together a coalition of people who would put something better together. Now, Teresa says that we can repeal it because Obama will veto it. What I'm saying is we've got to get that Tea Party caucus, we've got to get the leadership there and put something that's targeted. I want to reduce health disparities, and I want to give something to Obama that he cannot refuse because it's going to be passed anyway. So I don't think that it's true that we can't repeal it. And then we would reform it, put in real reforms and things that there's a broad consensus already between Republicans, Democrats, and Independents.
Ms. Collett?
The Patient Affordability Care Act was passed on two premises, and Representative McCollum promoted it on that basis. Number one, that it would provide health care for the uninsured in the United States. And number two, that we had to get health care costs under control, particularly for business people. The simple fact is, its enactment has proven, as Nancy Pelosi told us, they passed it and now we're finding out what's in it, that there will be 19 million uninsured in 2019 after Obamacare goes into full effect. So that they failed on their first initiative. The second is getting health care costs under control. And the Office of Medicare and Medicaid has already said that, in fact, we're going to see significant rises under the Obamacare positions. So they failed to get health care costs under control. The very reasons that they passed this bill are the reasons that it is failing. It's not just insurers. We have local employers here. Medtronic told us that it was going to have to lay off 1,000 employees in order to comply. 3M told us it was going to cost $90 million to comply. The simple fact is it has not stopped healthcare costs from rising. It has increased healthcare costs.
Thank you. Representative McCollum.
Well, I'm very proud of my vote to move healthcare forward in America. Bankruptcy for middle-class families. The largest reason why most middle-class families found themselves filing for bankruptcy was health care. People who found themselves in the middle of cancer treatment with a cap on how much money was going to be spent on their chemotherapy. That's gone under this bill. I talked to a small businessman just the other night. He has epilepsy. He joined a small business firm, and he said, I don't know if you're going to want to insure me. I'm going to make your rates go up. But the small business owner insured him anyways because it was the right thing to do. This piece of legislation that I voted for is going to make pre-existing conditions not be used against you when you go to apply for health care. It's going to keep middle-class families from falling into bankruptcy. And for the first time ever, for those employers who have worked so hard to provide access for health care, it's going to help them by paying up to 50% of their costs in the year 2014. We're scaling it up starting this year. I'm very proud of that vote.
Well, that is a shift. We're seeing a shift away from older people receiving the increasing amounts of medical care that they need. Debate focuses on Betty McCollum stating her pride, defensively standing by her positions and the things she's worked for, and backing away from coming out front and saying she is continuing to want to replace the market-driven system with a public option. We know that no market competition can exist when the government gets in with a public option. The key issue becomes, how do we get back our health? How do we save our healthcare system, as I have said? And I'm saying the only way that we can save the healthcare system is by repealing the action that was taken this last year, but not replacing it with the public option, as Betty McCollum has already said she wants to do, and introducing House Resolution 5808 to the House of Representatives.
Would you vote to repeal or replace the health care bill? Why or why not?
I've already touched on that, but definitely I would repeal it, and that is because I believe with the new government that's going to be formed to fill in the power vacuum that's resulted from the crisis of leadership that we now have in Washington, I believe that we're going to be able to put something forward that's really going to save lives, going to address health disparities by reducing the gap between various races who are affected by these killer diseases like cancer, like heart disease, diabetes, lung disease. And I believe Obama's going to have to accept it. And so I think this is a matter of leadership. Now, I've signed a contract from America, and part of that is to defund, repeal, and replace Obamacare. And I totally agree with that. There's a lot of good things in that contract, and I can't wait to get there and get this done and start the country moving in the right direction again. Again, I've said as far as defunding, if there's some kind of a program that is saving lives, I would be willing to fund that program in exchange for a quick repeal of Obamacare. I think that is actually a tool that the Congress would have.
Thank you, Ms. Collett.
I actually prefer Congressman Price's formulation. We need to replace everybody that voted for Obamacare, then we need to repeal it, and then we need to reform the health care program. Obamacare is premised on the idea of government-centered health care, including the idea that government can control what we need and get in between our doctors and their diagnosis and our treatment plans. What we need to do is replace it with patient-centered care. We need to reconnect the consumer with their health care costs. I would be in favor of creating the same sort of tax treatment for individuals who purchase. Now, I'm not saying there's no role for government, because of course there is. We do need full insurance plans for small businesses. We do need this for people with disabilities. But we certainly don't need the comprehensive takeover of health care that has been attempted in this monstrosity.
Thank you. Representative McCollum.
I would not vote to repeal something that's very important to the state of Minnesota.
Vote for the Independence Party and the Tea Party candidates in 2010.